Yes.
I would assume that could also be possible for just one eye. Like I know when I wear my
Yes.
glasses, I only have one eye that is at all impaired. So can
Yeah.
people be legally blind or legally impaired in one eye?
When you
How does
can
it-
be legally blind in one eye, but to qualify as legally blind for the purposes of benefits or anything, it has to be that your vision is that poor in your better eye. So if you have one eye that is still really good, you don't qualify as legally blind, even if one eye is totally blind, even if you had a prosthetic eye, you wouldn't qualify as legally blind because your good eye would still allow you to see.
Wow.
Is that clear? Okay. So I'm just going to briefly talk about the most common diagnoses. So age-related macular degeneration is one of the ones we see the most because of our aging clientele. So the retina is the back of the eye, right? You've probably heard of it before. That's where there's all sorts of light-sensitive cells that detect the light, change it into a chemical message, and then send it to the brain. And the brain figures out what it's seeing. Now, in age-related macular degeneration, the macula is a tiny area the size of a pea on the retina. Now that tiny little area the size of a pea is responsible for all your detailed vision, for all your color vision, and all your central vision. The rest of the retina around that pea-sized area is responsible for your peripheral vision. So with age-related macular degeneration, that macula starts degenerating. Some of the cells die off, some of the cells are just getting old and not working as well. So your vision just naturally doesn't work as well. So you start having reduced central vision, reduced color vision, and most people with age-related macular degeneration never go completely blind because their peripheral vision, the part around the macula, can still work. So they'll still be able to see something, just not as clearly. Is that clear to people?
Yes.
So I wish I could show you this really wonderful slide that shows that. Oh yeah, okay, I'll show you. So this shows what life is like with age-related macular degeneration. It just basically shows an image of two boys and a ball, and in the center the vision is blurry because you end up having a central blind spot. So that's with age-related macular degeneration. There's two types of age-related macular degeneration. I won't go into the details of them. Most age-related macular degeneration, there's nothing you can do, you just progress with time. But if you have the more severe kind, the kind that progresses fast, there is a treatment for it, but it does involve getting needles in the eyes. So, unfortunately, the needles in the eye do make a difference. So you at least have that consolation in that you do know that they can make a difference if that's what's necessary.
Unfortunately, the needles don't actually cure it. It just slows it.
They can slow it down or maintain the vision. The other one, another condition that I mentioned to you briefly was glaucoma. So the optic nerve, the nerve that takes the messages from the retina to the brain, can get pressure on it. So you may have heard of when you go to the eye doctor, they test you for your eye pressure. And if your eye pressure gets too high, that can put pressure on the optic nerve, and then you can start getting tunnel vision if it gets too bad. But glaucoma is called the sneaky disease because you can have it for ages and have no symptoms whatsoever. That's why it's really important, especially if you have a family history of the disease or after the age of 45, to go for regular eye checkups. because you can have glaucoma and not know it. And glaucoma, unlike age-related macular degeneration, can completely take away your vision. Cataracts, but they're very common. It's almost considered a natural stage of aging. So what a cataract is in the eye, behind the cornea, which is the outer part of the eye, there is a lens that focuses the light on the retina. The lens with age gets older and gets yellower and gets thicker. And if it gets too yellow and too thick, it can actually start blocking some of the light getting through. So a lot of people have reduced vision because of cataracts, and cataract surgery is one of the most effective surgeries that there are. About 95% of patients who have cataract surgery have improved vision afterwards.
So would that be equivalent to repetitively using a telescope and that telescope's lens catching a buildup from the skin?
Oh, I could see you suggesting something like that. If you don't clean the telescope lens very often, you're doing a really lousy job of getting that telescope lens dirty.
That's a similar thing. It's just the dirtying of the lens.
Yeah, it's basically that, and they generally, for most cases, they actually replace the lens with an artificial lens these days.
Yeah.
And these days, what they can do for some people is they'll replace the lens in one eye with a lens for distance, and the lens in the other eye, lens for near. So you can use one for distance, one for reading. It's a little difficult for walking around sometimes, but some people like that.
Yeah. Cool.
So cataracts, I don't know if you can see that. Basically, it's the idea that the image is all blurry overall. And generally, some of the colors... Oh, I'm probably not getting full screen.
Yeah.
I didn't think of that until it became worse.
You keep talking. I'll
And often people with cataracts, they have reduced color vision. So people after cataract surgery, they comment on how the colors are so much brighter and so much better. So diabetic retinopathy, we briefly touched upon. So again, the best way to control diabetic retinopathy is to control your blood sugars. And like I said, is your vision can vary from day to day. So you have to be understanding of somebody with diabetic retinopathy. Just because they have better vision one day doesn't mean that when they say that they can't see, doesn't mean that they're not having problems.
But diabetic retinopathy can progress to
Total blindness
total
as
loss.
well.
Yeah.
Yes.
So if you continue to not be able to keep your sugars within the good levels, and some people, they can try their very hardest and still cannot manage that regulation, but that will lead to more and more damage because the increased blood sugars actually damages the blood vessels. So that's why you get damage in your eyes, because there's very small blood vessels. You get damage in your kidneys, almost wherever there's tiny blood vessels. So that's why retinopathy is it treatable? Yes.
Some laser surgery.
Yes, you can get laser surgery. So, for example, someone who's fairly young, who's had diabetes since they were a child, for example, they might start to lose their vision even in their 30s, late 20s. They can go in and have laser surgery to repair, stop the bleeding in the little blood vessels, and that will preserve vision. Sometimes they'll retain some of their vision. So they will be very closely monitored to try and preserve as much vision as they can for them.
So the best way to avoid or treat that or keep the moderate rate is just to watch your sugar.
Exactly. And this is an example of vision with diabetic retinopathy. You can see that it's all splotchy and irregular, and that's what it's like today, but it could be splotchy and irregular in different ways the next day because it depends upon the bleeding patterns of the veins and arteries attack.
As I was working at Embassy West, this dementia patient who's diabetic also couldn't see well And I used to think if she can get proper diagnosis, if she can explain properly, but I think can find out what is wrong, even if the patient doesn't talk for themselves.
That's
Right.
true. Yeah. It can be very tricky. When they can't speak for themselves and they can't describe things, it's very hard to know what's going on.
So a person, well, any person who is diabetic, is that the first thing that is attacked? Is their vision if they're not taking care of their blood sugar level, or is
It can be one of the first signs. That's one of the things. Detecting diabetic retinopathy, doing the retinal scans can actually be sometimes the way that they diagnose that you have diabetes. But it's not necessarily the first thing. Often people with diabetes, it's not unusual someone who's had diabetes for 15 to 20 years to develop diabetic retinopathy. Like it's not always the first thing, but it can be telltale. You know, sometimes that's the way they diagnose diabetes.
Because everything I've ever seen on TV or whatever, you know, diabetics are losing limbs or legs, arms, you know, we never hear anything about the vision.
It might be because it happens. Maybe it's happening a little bit later, or maybe because it's more gradual too. You know,
I just sounds like it's something that people don't talk a lot about. It's interesting. Yes, losing a limb is horrible, and people can identify with that easily. Other people who don't have diabetes, they can really see that connection. Versus losing parts of your vision, it's harder for other people to.
Well, the media, like I said, anything I've heard about diabetics is, they need to control their sugar level, their intake, but anything on TV and shows and stuff, you know, you hear them about losing body parts, and I've never once heard of a diabetic
retinopathy.
And it's all related to the same thing. It's all related to the fact that the high blood sugars damage the blood vessels. So you lose limbs, you lose extremities because that's where there's smaller blood vessels, right? So they become damaged, you can't feel as well in your fingertips or your feet, and you are much more prone to infections because the blood can't flow through easily back and forth. It's the same thing. Kidneys have tiny blood vessels, they are prone to damage. Eyes have tiny blood vessels, they are prone to damage. So any part of the body, if you have significant diabetes, can affect any of those blood vessels.
So in relation to glaucoma patients and marijuana, is that why some of them get prescribed marijuana, because it expands
Dilates.
blood vessels in the
I have not heard of that.
Yes, they do. I've heard of it, but I'm actually not sure why.
Well,
Don't know.
Like people who smoke pot are known to have really bloodshot eyes.
Right.
And I guess that
Pushes the blood,
Yeah, I guess
increases
that
the
expands
circulation.
blood vessels and pushes more blood.
I don't know unless
Just
it's
research project for you.
have you look into that.
Your term 2 project.
I think it must reduce the pressure in some way. I'm guessing that's why they would use it, because it reduces the pressure as opposed to the
Although not all glaucoma is pressure related,
Yeah.
there's glaucoma that's not pressure related too, that they don't understand quite why it's working like that.
Yeah, that's right. There's more pressure.
Yeah.
Anyways, well, no, it's a good question.
Okay, we'll have to look
You're
into that.
you're assigned to go find out.
So there's many other eye conditions that can also affect people. You may have heard of retinal detachments before, where everything goes all black. They can sometimes correct that with surgery, but it's not a given. There's dystrophies, so there's rod and cone dystrophies that they're called. So the rods and cones are different cells in that retina that I described to you. Some rods are sensitive to light and dark, cones are sensitive to color. I won't go into detail of that because it can get quite complicated. But just to say that there are dystrophies that can target one or the other. So there's ones that target your fine vision, and there's ones that target more your peripheral vision. Then there's other things that you've probably heard of, neurological vision loss. So people get vision loss associated with dementia, tumor, or brain injury, or the thing that people probably have heard of the most is stroke. So with stroke, you can get visual field loss. I'll just show you, that's the easiest thing to show, is because of the way the instructions cross over in the brain. I don't know if you guys have heard before that the left half of the brain affects the right side and the right half of the brain affects the left side. Well, there's similar sort of effects in terms of the visual field, and that the visual field is actually cut in half. And so when you have difficulty with one side of your brain, so if you have difficulty with the left side of your brain, what can happen is you can lose the right half of your visual field in each eye. So what you have is in this eye, you will still see the left half of the vision field, but you'll be missing the right half. In the other eye, you'll be still able to see the left half, but be missing the right half. Yes.
So it doesn't even have to affect the occipital lobe itself. It could just be another part of the brain entirely, and it'll affect the eyes.
Well, it'll likely be the occipital lobe, but it'll be the right or left side of the occipital lobe. But there's all sorts of different areas of the occipital lobe that can be affected, that affect different parts of the vision. Sometimes it's actual ability to see. Sometimes it can actually be things like actually being able to recognize words, actually being able to put a name to a thing. They can look at the letters when you show them, but they can't say that that's a number 6. Sometimes they can trace it with their hand, even though looking at the number, they can't say what it is.
Are people prone more if they've had stroke or have aneurysm to get those?
There is a lot of vision deficits related to strokes. Sometimes if you just have a transient ischemic attack, which is one of those light strokes, one of those ones that doesn't necessarily cause as severe damage, then you don't necessarily get vision damage. But a full-blown stroke, it's not unusual to get vision damage associated with it.
Do you, CNIB, do you deal with a lot of people who have neurofibromatosis and who their sight is affected? Like most, I know people, I know a person who has neurofibromatosis, and I was talking to Noah outside how she could see us as far as shadows. Mm-hmm. So I'm thinking clientele who may have like such as neurofibromatosis, tumors in the brain, and the first thing that gets attacked is their sight.
Yeah.
And is that common for NF patients? And
So I guess the answer to that is we actually work with anyone who has a functional loss of vision. So if it's affecting their ability to complete tasks, whether it's reading, whether it's preparing a meal, whatever, and it's not correctable with glasses, right? I always say that. If you can get glasses on and it's corrected, then we don't see them. But if whatever vision loss they have is affecting their function and they can't make it good again with their glasses, then we would work with them. The confusing part with tumors or cancer, anything like that, we may not see them because it may progress too quickly. I guess that's the way to say it. So my sister-in-law died from a brain tumor. She lost her vision completely as part of that, but the rehabilitation would have taken much longer than how long she had left to live to be able to to work around that. So you might, we might as an agency be able to suggest some simple things to make it work easier in the short term for a couple of months. But generally they wouldn't come for rehab for that unless they actually were predicted to continue to live. It was going to be a long-standing, stable tumor. Then yes, absolutely.